Hi, my name's Manoj Krishna. I'm a spine surgeon. And today I want to present a case of a patient who's had pain in the back for 30 years. She's now 43 and the pain started when she was 13. She had a scoliosis of the lumbar spine, but along with that, she developed low back pain. This was treated with a variety of conservative treatments over the years. You can see how the bottom disc is collapsed and lost its normal height, but nothing was successful. And then she found out about me from one of my patients. And then on this MRI, you can see the bottom disc is really collapsed in height. So we operated on Andrea doing a posterior lumbar interbody fusion, where we took out the disc at the bottom and put a cage in and packed the disc with bone. We also put some screws and rods, and we stabilized the level just above with a spacer. It's really gratifying that after 30 years, she's completely pain-free. And here she is telling a story. Okay, good morning, Andrea.
Good morning, Mr. Krishna.
So, how old are you?
I'm 43.
And what sort of work do you do?
I work in a school, so
Okay.
I teach children.
You teach children.
Mm-hmm.
So, tell me a story about your back problem, when it started and how it started.
I started when I was about 13, 14. I was diagnosed with scoliosis, curvature of the spine. Went to a hospital in Leeds, and since then really had back problems that got progressively worse.
Low back pain.
Lower back pain and pain down my leg at times when it gets really bad.
Okay. And this was affecting your quality of life because you couldn't sit?
No, couldn't sit for long, couldn't stand for long. It was, when I had pain down my leg, I was really incapacitated, had to have injections to try and relieve it and things. So.
Okay, and what treatment did you have over the 23 years that you had the pain?
Medication, really. Painkillers, strong ibuprofen. I was living on probably up to 12 tablets a day towards the end. Mm-hmm.
And you had some physiotherapy and exercise in the meantime?
I did, yes, which helped a little bit, but really nothing long term.
Okay. And then what is it that prompted you to come and see me? Because it's been a long time.
My mum had actually been to see you.
Okay.
And you did an operation on her, and I'd also heard of somebody else that had been.
So it wasn't, okay, so you came via recommendation from a patient. Yes. So when we did your x-rays and scans, we found the disc at the base of your spine was worn.
Yes.
And of course, on top of that, you had this curvature of the spine.
Mm-hmm.
So we operated and we did a posterior lumbar interbody fusion, or a PLIF.
Yes.
Now about, 6 months ago?
Yeah, it was the 18th of January.
Okay. Yeah, so about 5 months.
Yeah.
And so tell me about the surgery, your recovery from it, and so on.
I was very nervous before it, but it was, I need to have been. I was up out of bed the next day when you came to see me.
Yeah.
And you made me walk down the corridor, which I didn't think I'd be able to do, but I did. And basically from then, it's sort of just slowly got better and better. Home within 2 days.
Okay. And how soon did you know that the pain had gone? The pain that you'd come in with had gone?
Within about 3 days, really. I was in pain from the operation, but not the same pain as I'd had before.
Okay.
Yeah.
And you're now 6 months from surgery.
I am.
Tell me how you're getting on now.
Absolutely brilliant.
Yeah.
Doing everything I want to do. I'm back at the gym. I do a lot of walking with the dog, swimming. No pain whatsoever.
Isn't that wonderful?
Brilliant. Yeah.
And you can sit comfortably and do all the things you want.
I can sit.
And you danced a Kaylee on the weekend.
We did. I was at a wedding at the weekend, and there was a Kaylee, and it was brilliant to be able to join in and be more or less pain-free the next day. A little bit achy, but absolutely nothing to what you want to do.
Andrea, thank you very much.